There are many different ways to treat psychological symptoms. Some involve therapy, or talking to a professional, but others involve just changing the way the body is functioning. And these are biomedical therapies. And there's three broad categories of biomedical therapies. You'll want to know what these categories are, you want to be able to tell them apart, and you'll also want to be able to identify examples of these types. So the first is a very long word. Get ready. Are you ready? It's the use of psychopharmacological drugs. I'll say that again. Psychopharmacological drugs. It's a fancy way of saying medication. But a lot of times the psychiatrist will prescribe medication to help someone with depression, anxiety, schizophrenia, a lot of different psychological disorders. There's different types of medications depending on the symptoms that you're trying to alleviate, and it can be a very kind of trial and error process. There's a lot of misconceptions about psychopharmacological drugs. Some people think it's an easy fix. It's not. A lot of times you have to find the right medication and find the right dosage and try this, and this doesn't work, and try something else. So a lot of people are disappointed when it's not a quick fix. A lot of people think it's a sign of weakness as well, but remember, some mental illnesses are only caused by a chemical imbalance. There's something wrong with the neurotransmitters, and so talking about it won't necessarily do any good. But psychopharmacological drugs can be very effective. They also have side effects as well. Nowadays you see a lot of commercials for these medications, and they tell you the positive effects, and they show you people running and smiling and playing with dogs, and then at the tiny bottom of the screen you see the side effects, or they'll go through them very quickly. So again, it's not an easy fix, but it can be a very helpful fix for many people. The second type of biomedical therapy is ECT, which stands for electroconvulsive therapy. Now this involves sending electrical currents through either half or all of the brain in the hopes of realigning the way the brain is operating. We used to use ECT very liberally for any number of conditions. Today it's mostly used for major depression that's not responding to therapy or to medication. There are side effects. It's painful, it's brief, but it can be painful. And kind of the biggest side effect is that it can affect memory. Some people have memory loss. But it's effectively helped many people with depression that wasn't responding to anything else. The third type of biomedical therapy is psychosurgery. This involves directly altering or damaging a part of the brain. The lobotomy is probably the most famous example of psychosurgery. And again, lobotomies used to be given for lots of different conditions. And lobotomies were very dangerous, especially when they first came to be. We didn't know as much about the brain as we knew now, so they were very kind of primitive, dangerous processes. A lot of people had damage done to them that was irreversible. You can't bring a part of the brain back once you destroy it. So lobotomies today are only used in a modified form in a much different way and for very specific conditions. So again, we have to constantly be critical thinkers and assess what we're doing, if it's the best, and if there's something we could do better, or if we need to stop something altogether. So make sure you know all three forms of biomedical therapy: psychopharmacological drugs, electroconvulsive therapy, and psychosurgery, and be able to provide examples of each.